Hey everyone! Welcome to our informative session on a common health issue that many people experience but might not fully understand. Let's talk about urinary tract infections, or UTIs. These infections can be quite uncomfortable and sometimes even painful, but understanding them can help you manage and prevent them. A UTI is like a little bug that can get into any part of your pee system. This system, also known as the urinary tract, is crucial for removing waste and extra water from your body. This system includes your kidneys, ureters, bladder, and urethra. Each part plays a vital role in filtering and expelling waste. Most UTIs happen in the bladder and urethra. The bladder stores urine until you're ready to go, and the urethra is the tube that carries urine out of your body. Think of bacteria like tiny little creatures that can cause an infection. These bacteria are microscopic and can multiply quickly if they find a suitable environment. Usually these bacteria come from your gut, where your poop lives. The gut is home to a vast number of bacteria, most of which are harmless or even beneficial. The urethra is the tube that carries pee out of your body. It's a crucial part of the urinary system, acting as the final passageway for urine to leave the body. Women have shorter urethras than men. This anatomical difference is significant because it means bacteria have a shorter distance to travel to reach the bladder in women. This means bacteria have a shorter trip to the bladder in women. As a result, women are more prone to developing UTIs than men. Understanding this can help in taking preventive measures. One of the best ways to prevent UTIs is to stay hydrated. Drinking plenty of water helps flush out bacteria from your urinary tract before they can cause an infection. Practicing good hygiene is also crucial. Always wipe from front to back after using the restroom to prevent bacteria from the anal region from spreading to the urethra. Some people find that cranberry juice or supplements can help prevent UTIs. While the evidence is mixed, it might be worth trying if you frequently get UTIs. If you suspect you have a UTI, it's important to see a healthcare provider. Symptoms can include a strong, persistent urge to urinate, a burning sensation when urinating, and cloudy or strong-smelling urine. UTIs are usually treated with antibiotics. Your doctor will prescribe the right medication based on the type of bacteria causing the infection. With proper treatment, most UTIs clear up within a few days. It's important to take the full course of antibiotics to ensure the infection is completely gone. Maintaining a healthy lifestyle can also help prevent UTIs. Regular exercise, a balanced diet, and avoiding irritants like caffeine and alcohol can make a big difference. Remember, understanding UTIs and how to prevent them can help you stay healthy and comfortable. Don't hesitate to reach out to a healthcare provider if you have any concerns. Now let's discuss some more details on UTIs. UTIs are super common, especially for women. About half of all women will have at least one UTI in their life. Millions of women get them every year. So if you have a UTI, you're not alone. It's a common health thing. Some women get UTIs again and again. These are called recurrent UTIs. They can be annoying, but there are ways to treat and stop them. There are a few reasons why women get UTIs more than men. Remember, women have a shorter urethra. This makes it easier for bacteria to get to the bladder. Also, the urethra opening is closer to the bottom in women, so bacteria from the bottom can easily get into the urethra, especially during sex or if you wipe from back to front after going to the toilet. UTIs, or urinary tract infections, can cause a variety of symptoms that can range from mild to severe. It's important to recognize these symptoms early to seek appropriate treatment. Some of the most common symptoms include a burning feeling when you pee, which is often one of the first signs. This burning sensation can be quite uncomfortable and may worsen over time if left untreated. Another common symptom is feeling like you need to pee all the time, even if you just went. This frequent urge to urinate can be very disruptive to your daily life, making it hard to focus on work or enjoy social activities. You might also find that you only pee a little bit each time you go, which can be frustrating. Additionally, your urine might appear cloudy or have a strong, unpleasant smell. These changes in your urine are signs that your body is fighting an infection. Pain in your lower tummy or back is another symptom to watch out for. This pain can range from a dull ache to sharp, intense discomfort, and it often indicates that the infection is affecting more than just your bladder. If the infection spreads to your kidneys, the symptoms can become more severe. You might develop a fever, which is your body's way of trying to fight off the infection. Chills and shivering are also common as your body reacts to the infection. Feeling sick or even throwing up can occur if the infection is severe. Nausea and vomiting are signs that your body is struggling to cope with the infection and needs medical attention. Lastly, you might experience pain in your back or side, under your ribs. This pain is often a sign that the infection has reached your kidneys, which can be serious and requires prompt medical treatment. Recognizing these symptoms early and seeking medical help can prevent complications and help you recover more quickly. It's important to see a doctor if you think you have a UTI. If you don't treat it, it can spread to your kidneys and cause big problems. See a doctor if your symptoms are bad or don't get better after a day or two of trying home treatments. Don't wait to talk to your doctor if you're worried about your pee system. Your doctor will ask about what's happening and your health history. They might do a physical exam, maybe checking your pelvic area. To be sure, they'll test your pee. This checks for bacteria and other signs of infection. Usually the pee test is enough to know if it's a UTI. Sometimes your doctor might do other tests like a urine culture or imaging tests. Sometimes things that seem like a UTI can be something else. For example, vaginal yeast infections, infections from sex, and other things can have similar symptoms. That's why seeing a doctor for a proper check is important. Most UTIs are treated with antibiotics. Antibiotics are medicines that kill bacteria. Your doctor will pick the right one for you based on the type of bacteria and your health history. Besides antibiotics, your doctor might suggest pain relievers for pain and fever. Drinking lots of fluids is also important to help wash out the bacteria. Here are some things you can do to help avoid UTIs. Drink lots of water, pee often, and don't hold it too long. Wipe front to back after using the toilet, pee after sex, and don't use scented sprays or douches down there. If you get UTIs a lot, your doctor might suggest taking a small amount of antibiotics regularly to prevent future infections. Recurrent UTIs are UTIs that come back. They are a common issue, especially among women, and can be quite frustrating to deal with. A UTI or urinary tract infection occurs when bacteria enter the urinary tract and cause an infection. When these infections keep coming back, they are termed recurrent UTIs. This can be a challenging condition to manage, but understanding it better can help you take control of your health. If you have 2 or more UTIs in 6 months, it is considered a recurrent UTI. This means that despite treatment, the infection returns, causing discomfort and inconvenience. Keeping track of your symptoms and the frequency of your infections can help your healthcare provider determine the best course of action for you. Or if you experience 3 or more UTIs in a year, you are also dealing with recurrent UTIs. This pattern of frequent infections can be distressing and may impact your daily life, making it important to seek medical advice and find effective management strategies. They can be annoying and affect your life. The constant worry about the next infection, the discomfort, and the impact on your daily activities can be overwhelming. It's not just the physical symptoms, but also the emotional toll that recurrent UTIs can take on you. But there are ways to manage them. Talk to your doctor. Open communication with your healthcare provider is crucial. They can help you understand why these infections keep coming back and what you can do to prevent them. Your doctor might suggest lifestyle changes, medications, or other treatments tailored to your specific situation. They can help you find a plan that works for you. This might include taking antibiotics for a longer period to ensure the infection is completely eradicated. Your doctor might also recommend other preventive measures, such as drinking plenty of water, urinating frequently, and practicing good hygiene. This might include taking antibiotics for longer, ensuring that the bacteria causing the infection are fully eliminated. It's important to follow your doctor's instructions carefully and complete the full course of antibiotics, even if you start feeling better before the medication is finished. Taking a small dose regularly or other things. In some cases, your doctor might prescribe a low dose of antibiotics to be taken daily as a preventive measure. Additionally, there are other strategies that can help, such as taking probiotics, using vaginal estrogen if you're postmenopausal, and avoiding irritants like certain soaps and feminine products. By working closely with your healthcare provider, you can develop a comprehensive plan to manage recurrent UTIs and improve your quality of life. Thanks for watching. Stay informed, stay healthy, and take care of your urinary tract. See you next time.